Hey guys, this is Dr. Hub. Let's look at the sensory receptors. So we are dividing this topic into two. One will be in case of the glabrous skin, in terms of the glabrous skin, and next will be in terms of the hairy skin. So first we'll be jumping into the glabrous skin. So let's write it down, glabrous skin. So the major components here, it includes the Meissner corpuscle. So the Meissner corpuscle. So here it is encapsulate dendrites. It includes encapsulated dendrites. And what are the components? The components is it is rapidly adapting. It is rapidly adapting. That is aphasic receptors. Next is it responds to changes in the texture and slow vibrations. It responds to the changes in the texture and in terms of slow vibrations. It is used for the 2-point discrimination. Used for 2-point discrimination. And next, let's move on to the Merkel cells. So here the Merkel cells are nothing but an expanded dendritic endings. They have an expanded dendritic endings. They are slowly adapting. It is slowly adapting, and they have presence of the tonic receptors. They have presence of the tonic receptors, as well as it responds to the sustained pressure and touch. So it responds to the sustained pressure and touch. Next we look at the Pacian corpuscles. So what is the Pacian corpuscle? So the Pacian corpuscle is nothing but it is encapsulated dendrites. It is encapsulated dendrites, and it is a very rapidly adapting touch receptor. It is a very rapidly adapting touch receptor, and it also responds. So it responds specifically to fast vibration and deep pressure. So to fast vibration as well as in terms of deep pressure. So this was all about the glabrous skin. So what we saw was about the glabrous skin. Now we'll move on to the hairy skin. What are the sensory receptors? In terms of the hairy skin. So in the hairy skin there is hair end organs. Presence of the hair end organs, or the presence of the hair follicles, hair follicle receptors. So hair end organ or the hair follicle receptors. So they are nothing but it is rapidly adapting. So it is rapidly adapting. It detects the velocity and the direction of movement across the skin. So it detects the velocity as well as the direction of movement. So it detects the velocity and direction of movement, and this is across the skin, across skin. Next is the tactile discs. So tactile disc is nothing but slowly adapting, and and it is similar to the Merkel receptors in non-hairy skin. It is similar to the Merkel receptors, and this is in the non-hairy skin. Next, we look at the other point, that is it responds to the sustained pressure. So tactile disc, it responds to sustained pressure. Then we look at the Ruffini's corpuscles. So the Ruffini corpuscle, so this is a slow adapting, it is slow adapting, and they respond to the stretch and fluttering vibrations. So it responds to the stretch as well as the fluttering vibrations. Next we look at the cross end bulbs. So what is this cross end bulbs? The cross end bulbs, they aid in the thermal sensation. So it aids in the thermal sensation.